Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with the experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. There are over 20 medications approved by the FDA to help treat MS. These are very often referred to as disease-modifying therapies, or DMTs. But with so many options, how does someone choose the right medication for themselves? Dr. Marijean Buhse is joining us today to talk about how you can work together with your healthcare provider in shared decision-making when it comes to finding the medication that's best for you. Dr. Buhse is a clinical professor at Stony Brook University School of Nursing and a nurse practitioner at the Comprehensive MS Center at South Shore Neurologic Associates. Welcome, Dr. Buhse, and thanks for joining us today.
Thank you, John. It's a pleasure to be here.
Most of the disease-modifying medications have been shown to provide the greatest benefit early in the disease, when the inflammatory process tends to be most active. Since they often don't address specific symptoms, there can be some confusion about their value. Can you take a minute to talk about the goals of these treatments and the importance of starting on an MS medication early?
Sure. It's so important. I've been taking care of MS patients for almost 24 years. And so since the beginning, when we only had 3 injectables, when I started, we had 3 injectables, we said to our patients, it's so important for you to go on this medication and stay on it, because we know over time that these medications, and not necessarily those 3, but all of the 20, have changed the nature of MS. Our patients with MS, people with MS, are not getting as disabled. They're not having as many relapses. Their MRIs are not changing for years. Now, prior to these medications, that was not true. It was MS, it was MRI and goodbye, diagnose and adios. So now we know how important it is for you to use, for any person with MS, to use a disease-modifying therapy.
You know, as I mentioned a moment ago, there are many disease-modifying medications to choose from. Now, I happen to be in the audience for your presentation on the topic of shared decision-making at the Consortium of MS Centers annual meeting this past June. And I thought a good place for us to start today is asking you to explain what is shared decision-making.
So shared decision-making is something that came about in the past, maybe 10 years, maybe 15 years. And what it basically is a method that allows healthcare providers and patients share the best available evidence with the task of coming up with a decision that's good for everyone, a decision that the patient feels very comfortable with, a decision that the healthcare provider can agree with. So when we talk together and we use the best evidence and we're able to discuss this, patients benefit and they're empowered because they've helped make that decision.
When we think about the traditional doctor-patient relationship, how is that relationship different when the patient is someone who's living with MS?
So I think that's a really good question, because for as I said, I've been in this for over 23 years, and I have people I've seen for over 23 years. I know them. I know their family. I know that their mom just passed away. I know that their child just had a baby and they're a new grandmother. And so we have this relationship that goes beyond just the healthcare provider patient relationship. It's not a 15-minute relationship that I see you once a year for your physical. It's a 30-minute relationship that I hope to see you 3 times a year, and probably will speak to you on the phone and talk about many other things. So it's really a very distinct relationship, because MS is a very distinct disease.
We heard from Jonathan, who says he's feeling confused. Jonathan says he doesn't know enough about MS, let alone the different disease-modifying medications and their different risks, to make a decision about which medication he should be taking. What do healthcare providers think about shared decision-making, and how can they help their patients like Jonathan feel more confident about participating in making these decisions?
Well, the most important thing that I think a healthcare provider would not do is talk about 20 medications. We just can't. There are so many, and many of them are different. But what I do as a healthcare provider is I look at the medications and I look at the person with MS and I say to them, which one would go best with this person? So for instance, if you are working, I live in New York, and if you're working in Manhattan and you have to take the train every day and you have a rough commute, perhaps one medication would be better than the other medication. So we really talk to them about, I talk to each person about which medication would be the best for them. And I usually bring it down to about two or three. These are the 2 or 3 that I think would work well for you. Let's talk about them. And then I think one of the most important questions to ask a patient who is going on this is, what do you expect that these medications may do for you or may do to you? Because I think sometimes the risk and the benefit in a patient's head is much worse than it really is. So we like to ask, if I come up with 2 options and my patient will say, no, I heard blah, 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 blah. Well, tell me what's really bothering you about these options. Or do you know other people who've taken this option? And what is a priority for you? Because I think when we talk about shared decision-making, I need to know more about you to hopefully guide you to the right direction. And that's what shared decision-making is about.
For some healthcare providers, this is a different approach to treating their patients. So what happens if a healthcare provider isn't accustomed to including their patients in treatment decisions? How can a patient advocate for themselves to be part of that conversation?
Well, it's a great question. And I think that if you have a healthcare provider and you've met them and you feel comfortable with them, that's the opening part. If you meet them and you say to yourself, no, but you're going because you feel like you have to, you don't have to. There are other healthcare providers that you can come and see. You could go and see if you feel uncomfortable, but really you have to be able and willing to question the response that you're getting from your healthcare provider. And that happens with me, quite often when patients will say to me, well, why do you want me to do this instead of do that? And I have a friend, I have a friend who's been on this instead of that. And I think I want to do what the friend has. And I'll say, well, the friend, I don't know the friend, but I think because of your disease, and as we all know who take care of people with MS, you've seen one MS patient, because everybody is different. So we have to look at your disease and help you see what is that may be different about your friend's disease and what option is the best for you. So I think you have to be willing and open to speak with your healthcare provider and expect answers in return. If you don't get them the way you feel like you should, perhaps that's not the person to take you through this lifelong journey, because it is a lifelong journey.
Given the cost of medications, their side effects, and their risk factors, Is it sometimes the case that a patient doesn't want to start on a disease-modifying medication? And if that were to happen, how would you approach that conversation with someone when the two of you are not on the same page?
So it's not infrequent that a patient says, I don't need it, especially with a new diagnosis. There's some times when patients just don't quite believe that they have MS, and they're concerned about that, and they've read a lot of information on the internet, and some of it is good and some of it is not so good. And so what we need to do is we need to explain to them, what I need to do is explain to the person, why is it so important for you to go on this medication? Because it is a lifelong journey. And I'll say to them, well, you take this medication perhaps for your bladder and this medication for this. You're not married to them, but you are married to your disease modifying therapy. Can we change it? Absolutely. If you feel like it's not working, absolutely. We can do all sorts of tweaks with it now that we have 20 medications to use and more on the horizon. But I think it's so important, especially early in the disease, to knock that disease out. And the way we knock that disease out and slow its progression and slow those relapses and slow everything is by these disease modifying therapies. And I think MS care centers are aggressively doing that. It may not happen with a general neurologist as much because that's not their focus. Our focus is MS, and we're aggressive in helping you go on treatment and stay on treatment.
Let's talk about some of the different factors that a patient and their healthcare provider might actually discuss about disease-modifying medications in one of these appointments. What would the conversation be like? Where does it begin? How do you get to that? And I think you've already started answering this. How do you narrow down the number of DMTs you're going to be talking about? And what other issues is it important for the healthcare provider to make sure they cover with the patient?
So, as I said before, it's so important to look at that person individually. And we look at everything. We look at your MRI, we look at your blood work, we look at everything that's come up. We look at how you function now, and we would do everything we can to keep you functioning in the same way. So I'll start the conversation is, okay, let's talk about these disease modifying therapies. Are you ready to talk about them? Are you ready to hear me? Are you ready? How much do you know about MS first, especially a new person, even 2 years in? Some people don't know enough about their disease. How much do you know about it that I can help you and guide you to the right medication? And then the patient has to be willing to verbalize their thoughts and feelings and their goals that they have for themselves and their values, what they value in life. Then together we can review options and make sure our goals are similar. The options are going to get them there as best we can. And then they also should know that there's a possibility for changes in the future. MS is not a disease that once you have it, it stays stagnant. So things change. And so as things change, options may change too. There are 10 influences that affect people who have MS, or people in general who are to see if they're ready for shared decision making. First of all, it's the age. Now, an older person may not want to question a healthcare provider because they may feel uncomfortable. Same with cultural background. Depending on the culture, am I going to ask questions or am I not going to ask questions because this person's such an authority? Believe me, we know a lot, but no, we're not that big of an authority. You are an authority on your own body and your own symptoms. You're the authority. Close relationships. Is there a close relationship between you and the healthcare provider? Do they have a significant other that they need to bring into the picture? And hopefully you do, because we would really like them to be involved in these decisions also. What about anxiety and depression? All that can affect how you feel about a disease modifying therapy. How about if you're just diagnosed and you're seeing me the same day you're diagnosed and you're like, so such emotional distress, perhaps that's not the time to say, and you need to go on a lifelong medication. Perhaps we need to meet again after that has set in a little bit. That goes with the acceptance of the disease. Once again, as I've said, I've had people who just will not accept that they have multiple sclerosis, even if they've had it 15 years. And then I show them the MRI. I know I've seen it, but I just can't believe it. And so that does occur. The relationship with the healthcare provider is important, and the decision type. And I think you have to be aware that these decisions on disease-modifying therapies may and will change as the disease changes in you. So be aware that this is, or you go on it for 3 months and you say, I hate this. It's really bothersome. So then you come back and we'll figure out something better for you. So be aware that you need to ask those questions and feel comfortable expressing yourself.
We heard from Derek, and he said that his doctor's appointments seem to fly by, and he doesn't have enough time to discuss everything with his doctor. So what advice do you have for Derek to help him make the most of his time and still get his questions answered?
I think that Derek should write them down, because it's so easy to forget once you're in that physician's or the physician or the healthcare provider's office. So for me, when I see a patient and I've known them for a long time, we may spend the first 10 minutes catching up. And then the person will call me later and say, I forgot to ask you, blah, blah, blah. So write them down and don't walk out of the office without saying, I need to ask you these questions. It's easy when you get wrapped up in other things, especially we do the physical, we go over your MRI, we ask you how you're doing now. There's a really set way that we do an exam in an exam room. But the most important thing is that we need to answer your questions. So make sure you write them down and make sure you come with them in your hand.
Well, we heard from Jean, and she has a question. She told us that the cost of her prescribed DMT is beyond what she can afford, and she wants to start treatment, but Jean's worried about how she's going to pay for it. Are there any options to make disease-modifying therapies somewhat more affordable?
Well, there are no options that the healthcare providers could do. However, the companies have made a lot of these disease-modifying therapies free or a low-cost option. I know that many of the companies, we have actually in our practice, we have somebody who actually contacts the companies for the patient. And so we'll say that the physician wants that patient on this drug, what can you do for them? They have this insurance and that insurance. And that very often there's free drug. Very often there's ways to not pay the copay, which sometimes the copays are astronomical, $1,000. And so there's ways to get them to zero copay. So a lot of these companies do that. There are some national outlets that will help find free drug for patients also. But your healthcare provider should be able to guide you to someone who can do that for you.
The role of disease-modifying medications is to reduce relapses and new lesions on an MRI. It's likely that they won't change any of the symptoms that people are experiencing. So how does someone know if their DMT is working? How do they know when or if it's time to consider changing that disease-modifying medication?
So I always describe it like hypertension. You never know if you have high blood pressure until somebody takes your blood pressure and they tell you, and then your healthcare provider will put you on a medication and you'll say, I don't know if it's working. I feel fine. But then you test your blood pressure and you know that it's working. So for this, we do a lot of tests also. Our MRIs will tell us if you have a new lesion. Your MRIs will tell us if something's happening. That's number one. Number two, symptoms are symptoms. And so if your symptom is numbness and tingling in your hands and in your feet, so those are your symptoms. That's how you were diagnosed. All of a sudden, one day you wake up and you're like, I can't move my leg. Well, that's a different symptom, and that may be a relapse. So when we look at relapses versus symptoms are, we could take care of with other medications, but relapses, the difference is that a relapse is a new or the same symptom that has just come out in full force and stays for over 24 hours. That's the relapse. So a new symptom that lasts 22 hours It's probably maybe you didn't get enough sleep, you would dance very hard at a wedding, but something that lasts over 24 to 48 hours and it's brand new is a new symptom, and that would be a relapse, and that's something that we would take care of. So many MS specialists have no we don't want any relapses. And so if a patient, we have no tolerance for relapses anymore. So if a person with MS does have a relapse, we'll think long and hard about whether or not that medication is working. So that's one of the ways we know besides MRI.
Well, we heard from Michelle, and Michelle tells us the medication that she's on has not been effective in reducing her relapses. She's also hesitant about switching medications. Michelle says she'd rather go off disease-modifying therapy entirely and not have to deal with any side effects. Can you explain why one disease-modifying medication might have a very different outcome than another?
Yes. So it's quite interesting. As I said, this disease is very interesting. And so you can start with one, maybe perhaps lower effective drug, and then move up to highly effective drugs, or sometimes healthcare providers put you on a highly effective drug immediately. And the reason depends upon your MRI. It also depends upon your any of your symptoms and how things are working. So we always have this escalation, or what else we call is an induction therapy. So we have choices between either putting you on a lower dose, a lower effective, that may work great for you. And I'm not saying they don't work great, they do. Or we have this option, if your MRI is really, shows a lot of lesions and you're really symptomatic, of putting you on a higher efficacy to just slow that disease process right away. And when when it comes to changing, people really know that they have to change because they know that it's not working and they're having more relapses. But we have so many options that we can find the right one for you. Side effects. I think when a couple of the studies I read about side effects, patients' belief of side effects are, for instance, in one study, the real side effect was maybe 0.02% of all the population on this drug. The patients thought that the side effect was 1,000 times more than that. So we hear things and we go, oh, if anything was going to happen, that's going to happen to me. Well, likely not. And we monitor you for all side effects too.
Well, I'm glad you brought up side effects. As you alluded to, they can range from mild and annoying to uncomfortable and sometimes problematic. How long should someone tolerate side effects, and to what degree should they tolerate them before they consider making a change in their DMT?
I think what I believe is that if the person cannot tolerate them, it's just too anxiety producing. They're not losing work time, they can't socialize with their family, you can't live your normal life, then that's not the drug for you. And we have so many other drugs that we can use. So I think side effects like that are problematic, and you should, the biggest thing about most MS drugs is that you should never stop them. What you should do is you should come and see your healthcare provider and say, I'm done with this drug. You could say that. They do in New York. I am done with this drug and I want to talk about what else I can do. And then we'll find, and I'll say to you, okay, hang on, until we get you on a new drug, just stay on this drug for this period of time. We are finding another drug for you. We'll get you on it within, however long the insurance company may take, a month or two, and then you'll be off this drug and on to the next one. The problem is if you stop most of our drugs, you could cause more problems to yourself if you abruptly stop. So we ask you not to do that. Let us know if your plan is to stop it, and then we'll get you to that point where you can.
Well, thank you for sharing some important insights on how shared decision-making can get someone to the right treatment plan for them. What would you say are the top 3 takeaways that you'd like our viewers to remember?
The first thing I would say is make sure you have a healthcare provider that you feel comfortable to talk to, that you feel comfortable to ask questions to. That's number 1. Number 2, feel free to ask your healthcare provider questions. don't think that we're thinking of everything. You know you better than anybody else. Ask those questions. And then the last one is, once you agree that you're going to start a disease modifying therapy, start it. If there's problems, let us know. But start it, because the disease is always active. And that's why we put you on these drugs, to stop the disease, to stop the relapses, to decrease lesions, and to decrease progression. So it's so important for you to take a disease modifying therapy, but you and your healthcare provider can decide which one's the best for you.
Well, I want to thank everyone who submitted some great questions, and thank you for being with us today, Dr. Buhse.
My pleasure.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways for you to get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Buhse for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webcasts. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Marijean Buhse and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.